Hi, behind me we are looking at a team of young people, young girls in Boyogere Secondary School, and they're trying to go through they're trying to go through counseling at the moment, and we'll be talking to some of them. We'll be talking to some of our girls that we help, that we pay school fees for, that we sponsor in this school as the training goes on. So we wanted you to see what we are doing. This is the work that we do. We do not only do it here in Boyogere Secondary School. We've been doing this work in about 450 schools that we have our children in, and we've been training them. We've been giving them the skills that they need. We've been helping them to understand how to move their lives in the right directions. And we'll be speaking to one of our health counselor who have been already conducting this counseling in Boyogere Secondary School. You're welcome. You can try to give us more, and what you've tried to understand from the students, and what you feel, where you feel we need help, and where you feel we need to do better. Thank you.
Okay, thank you so much. My name is Juliet Chigonya from Nurses Concern for Adolescents, an organization by nurses that is addressing concerns of young people in schools, the challenges they experience, and how we should go about those challenges. We partner with Medical Africa International because it is an organization that has been existing for quite some time and running a lot of programs in so many secondary schools. We've gone to a number of schools, and particularly today we are in Boyogere Senior Secondary School. Today we came to address teenage pregnancy among young people, or the girls or teenagers. But although we came to do that, we do a lot of activities as we go to a particular school. We are doing screening for pregnancy, but again we're also carrying out sensitization. We create awareness to these young people about what are the dangers, the particular dangers surrounding teenage pregnancy. How should we control ourselves? How should we, what is that sexuality aspect that exposes us to a lot of risks? And while we are in these schools, we come to realize that sexuality is an issue to be addressed at all levels, right from primary, secondary, and even university. And the most challenging thing is young people today don't know how to make decisions. They are kind of driven by the changes they're experiencing in their bodies. When they get attracted to the opposite sex, they think that is love. So we need to empower them with the right information so that they make informed choices. Because knowing that if I do this, the result is this, and knowing that if I go and make such a choice, the consequences are these. Am I ready to bear the consequences? If you feel you're not ready to bear the consequences, then you don't make that choice. I think that is something that is still lacking among young people. We've also realized that there is a lot of candida breakdowns among our girls. So I think that the health workers at school, the nurses, the school nurses, kind of need to be empowered, a little more empowered, maybe given some kind of continuing medical education sessions like we do in hospitals, where people are informed of every other new thing coming up. So they need to be empowered so that they learn how to address challenges of these young people, since they are the ones who are staying with them at all times. The other thing we are realizing that some of the nurses they are having in schools, the healthy workers in schools, the school nurses, school psychologists, and all that, kind of don't practice their ethics. They lose their ethics. Some people say when they tell them their problems, they find their problems being discussed among young people. So the nurses, the school nurses, I think they need to be called for CME so that they are reminded of their ethics and they kind of practice what they preach in the way they handle these young people, because this is a very sensitive age. Sometimes they fear to speak out because of low self-esteem. Sometimes they feel embarrassed about what they are going through, even if it is a normal physiological process of their body. But if these nurses are kind of empowered and sensitized in how to address these problems and how to handle these adolescents in schools, then I think the school environment will be good for them. We also have a challenge that many young people today practice sex at an early age. Some of them, they think it is love. So I think these sessions need to continue. And sexuality education, sex and sexuality education, if it were possible, it should be kind of introduced in schools as a package, you know, so that it runs on from term 1 to third term, and from class senior 1 up to senior 6. And they should be taught, for instance, those in A level, how to address relationships, because they think this is a normal relationship and yet it is an exploitative relationship, you know. And the other thing is, these people need, children, adolescents need to be empowered in some kind of income generating activities in schools, and so that they are provided with the basic items to use, you know. Some of them are exploited sexually because they want to get some little money to earn a living, to live on, to buy the things they need. And another thing, we also realize that they lack some information. They lead a life of myths. They don't know the facts. So they live on rumors, what my friend said, and peer influence is also very high. So and so said this and that, you know. So and so says that if you don't have sex before 20 years, your virginity will harden, and in future you'll not be able to have sex with a man, and you can never conceive, which is wrong information. So we have to go down to these children and tell them the right information, because we medical workers, we are the ones with the right information for these children.
Thank you so much. Thank you so much. And like what she was saying, we've been doing this work for over 7 years, and we feel that at the moment where we have reached, we need your support. We need to work with different people. We need volunteers to come from different countries to come together so that we can take this work forward. We want to make sure that the work we are doing can go across Uganda. We still have many children, you know, that are not going to school, many children that do not have an opportunity to get mentorship. This is what we are trying to do, and we are sure that if we can work together, we can be able to create a better Africa. Africa where all of us can prosper. Africa where all of us can have the right knowledge and the right skills that we need. Me working with MAI and working with Acumen as an ambassador has given me a very, very great platform to be able to see such information firsthand and to be able to work with such people. It's a great privilege working with this organization. It's an organization that started from scratch. It's an organization that funds itself. It's an organization that is literally every year it's able to raise more than $100,000 on the ground. So we think and we believe that if you come out and we work together, we'll be able to make a very, very great, wonderful job.